Welcome to the deep dive. Today, we're tackling a really important topic for anyone who shares their life with a dog or cat. Primary immunodeficiency.
hmm
We've got a key resource, primary immunodeficiency in companion animals, and our mission really is to understand what happens when a beloved pet has a kind of genetic quirk in their immune system.
Yeah, one that makes them more vulnerable to everyday germs.
Exactly. We want to break down the basics, look at why some breeds seem more susceptible, and, why this knowledge is just so vital.
Absolutely.
Okay, so let's get right into it. What exactly are primary immunodeficiencies?
Well, think of it like this. A primary immunodeficiency is basically a heritable glitch. It's in the system, the machinery that protects an animal from infections.
Okay, an inherited problem.
Right, a fundamental issue with how their immune system is built.
Mm.
And these glitches, they can affect different parts of that machinery.
Like what specifically?
So some involve the cells that, directly attack invaders, think viruses, fungi. Others impact the system making antibodies, which are crucial against bacteria.
Oh, okay.
And some even mess up the processes that, like, clear out pathogens entirely, the phagocytic or complement systems.
Got it.
And what's really interesting is, depending on which part has the defect, the animal will be more prone to very specific kinds of infections.
That makes perfect sense. So, weakness in antibodies means more bacterial trouble,
Hmm.
while problems with the attack cells mean more risk from viruses, fungi, protozoa.
Exactly. And those phagocytic or complement issues often lead to more widespread disseminated infections.
No, it's not just the immune system itself that feels the impact of these inherited issues, is it? Our source hints at effects on other parts of the body, too.
Absolutely.
Yeah.
Yeah, while the root cause is within the immune system, often a shortage or malfunction of certain immune cells, the constant fighting, this battle against infections, it has wider consequences.
Like what kind of things?
We often see persistent, recurrent problems, skin issues, ears, the respiratory system, even the GI tract, chronic or recurrent infections there.
Right.
And because their bodies are constantly fighting, these animals can also really struggle to grow and thrive. Just general failure to thrive.
It makes sense.
And in severe cases, if infections spread, other organs can definitely be affected too.
And this is where the genetics really come into sharp focus. Our source emphasizes these tend to be breed specific. Like certain breeds just have a higher chance of these vulnerabilities. Why is that?
Exactly. They're passed down, inherited, and we see some very clear patterns, specific breeds more susceptible to specific immunodeficiencies.
Can you give an example?
Sure, take X-linked severe combined immunodeficiency, SCID. We see that in Basset Hounds and Cardigan Welsh Corgis.
Okay, X-linked SCID.
Right. The X-linked part tells us the gene is on the X chromosome. So it's interesting, male dogs with just one X, they'll be affected if they get that faulty gene.
Mm.
But females with two X chromosomes, if they have one faulty copy, they can be carriers, often without showing symptoms themselves.
Okay, carriers and severe combined.
Yeah, that tells you it's a really serious one, affecting multiple arms of the immune system. Then there's another SCID, severe combined immunodeficiency disease, in Jack Russell Terriers,
Mm.
another significant inherited defect.
Wow.
And what's striking is how these breed links really highlight the impact of, well, selective breeding and maybe smaller gene pools in some lines.
Yeah, that makes sense.
It really underscores the responsibility breeders have to be aware of these inherited risks.
It's quite a list when you look at it. Our source mentions IgA deficiency in beagles, German shepherds, sharpies, IgM deficiency in Dobermans, thymic hypoplasia in those dwarfed Weimaraner's,
Yep.
cyclic hematopoiesis in gray collies, and even for cats, Chidiac-Higashi syndrome in Persians.
That's right.
Plus, leukocyte adhesion deficiency in Irish setters, complement deficiency in Brittany Spaniels, that bactericidal defect again in Dobermans, and transient hypogammaglobulinemia in Samoyeds. It's a huge spectrum.
It really is.
Does that point to maybe a broader issue of genetic health in some purebred populations?
That certainly raises the question. I mean, the fact we see these specific links, breed to problem, strongly suggests certain immune pathways might just be more vulnerable to mutations within those populations.
Yeah.
And as the source notes, these conditions usually pop up within the first year of life.
Why then specifically?
Well, it often lines up with when the maternal antibodies the protection puppies and kittens get from their mom start to fade away.
Okay.
Their own immune system is supposed to be taking over fully then, right? So if there's an underlying defect, that's often when you start seeing the signs emerge.
Okay, so for a pet owner, beyond knowing the breed risks, what are some key things you might see that suggest it's, more than just a common cold or bug?
That's a good question. It's not just the odd sickness.
Mhm.
Key things to watch for are a pet getting sick really frequently,
Okay.
and maybe more worrying, when those infections just don't respond well to standard treatments, like the usual antibiotics.
Right, not clearing up.
Exactly.
Yeah.
You might also notice they're often tired, lethargic, maybe poor appetite, ongoing skin infections.
Mm-hmm.
And importantly, that failure to thrive we mentioned, not growing or putting on weight like they should, that's a big flag.
Yeah, the body's just constantly fighting, no energy left for growth.
Precisely.
Our source also mentioned something tricky, vaccines, specifically modified live virus ones. Why can those be a problem?
That's a really critical point. Modified live vaccines use a weakened virus,
Right.
to stimulate immunity without causing the actual disease.
Yeah.
But in an animal with a weak cell-mediated immune system, the part that normally handles viruses, even that weakened virus, can be too much. It can overwhelm their defenses and actually cause the disease it's supposed to prevent.
Wow, okay. That's serious. So, if a vet suspects a primary immunodeficiency, how do they go about figuring it out? It sounds like it needs more than just a standard checkup.
Oh, absolutely. The first crucial step is ruling out secondary reasons for a weak immune system. Acquired reasons.
Like what?
Things like certain hormone imbalances, hyperadrenocorticism, or Cushing's disease,
Mm-hmm.
or viral infections that suppress immunity, like FLV or FIV in cats.
Got it. Rule those out first.
Exactly. You have to exclude those. The classic picture that makes you suspect a primary issue is usually a young animal, recurrent infections, just not responding to normal treatments.
And then you move on to more specialized tests. The source lists quite a few lab procedures.
Yes, a full workup is often needed. Initial blood tests, CBC, biochemistry, and a urinalysis might give clues. Low cell counts, signs of chronic inflammation.
Yeah.
A serum protein electrophoresis can be a good screen for like a major lack of antibodies overall.
Starting point.
Right, but to really pinpoint the problem, you often need more detail, things like serum immunoglobulin quantitation.
What does that measure?
It measures the levels of the different antibody types, IgA, IgM, IgG. That helps find specific deficiencies or even a total lack of antibodies, which is called a gammaglobulinemia.
And the investigation can go even deeper, can't it? Things like lymphocyte transformation tests.
Yes, that looks at how well those direct attack cells, the T lymphocytes, are working.
Okay.
Then there are bactericidal assays to check neutrophil function. Those are key scavenger cells. You can measure complement proteins too, and even count specific types of immune cells like T cells and B cells. Gets very detailed.
Sounds like it.
It really does. And like our source says, some of the most specialized tests might need samples sent to research labs that really focus on these rarer conditions.
Right.
And sometimes biopsies looking at tissue from bone marrow or lymph nodes can give really valuable information to help classify the exact type of immune deficiency.
So when the pathologists look at those tissues, what are they typically seeing? What changes point towards one of these conditions?
Well, the lesions, the changes they see, can vary
Yeah.
quite a bit depending on the specific defect.
Okay.
But a really common finding is just evidence of those recurring or opportunistic infections we talked about, affecting skin, ears, respiratory tract, GI system.
The usual suspects.
Yeah. And in severe cases, you might see signs of septicemia, that's widespread infection in the blood.
Right.
Looking deeper, if it's a T lymphocyte defect, the thymus gland, which is crucial for T cell development, might be underdeveloped, hypoplastic or even dysplastic. Similarly, with B lymphocyte defects, you might see underdeveloped areas in the bone marrow or lymph nodes where those antibody-producing cells should be maturing.
So a lack of development.
Often, yes. Though interestingly, depending on the defect and whether there's an active infection, you might sometimes see lymphoid hypoplasia, lack of tissue, or even hyperplasia, which is an overgrowth in some areas. It can be complex.
It really paints a picture of the constant struggle these pets face. Now, when it comes to helping them, the source is pretty clear these conditions can't be cured. So what does treatment and management actually look like?
That's such a vital point for owners to understand. The focus isn't cure, it's management, controlling and preventing infections.
Okay.
Now, depending on how severe things are, that might mean hospitalization if there's a really bad infection. Other times, milder cases might be managed at home.
Right.
Supportive nursing care is always key, tailored to whatever infection they're fighting.
Yeah.
Activity levels? Well, that just depends on how sick the animal is feeling.
Makes sense. What about diet?
Good nutrition is definitely important, but it's generally recommended to avoid feeding raw meat,
Why is that?
just because of the increased risk of foodborne infections in an animal that already has a weakened immune system, you don't want to add another challenge.
Good point. And it sounds like owner education is just absolutely critical here.
Huge. Owners need to understand it's lifelong, why their pet gets sick so easily, and that it's inherited.
Yeah, implications for litter mates, future breeding.
Exactly. And taking extra care to avoid exposure to other sick animals becomes really important too.
Okay. What about medications?
Well, antibiotics are the main tool for bacterial infections, obviously.
Right.
For pets with antibody deficiencies, sometimes giving infusions of gamma globulin or plasma can help temporarily boost their antibody levels.
Okay, like borrowing some protection.
Sort of, yeah. But there's a really important warning here.
What's that?
For animals with one specific type, selective IgA deficiency, giving gamma globulin can actually cause a severe allergic reaction, anaphylaxis.
Oh, wow. Okay.
So you have to know which deficiency you're dealing with. It's critical. Beyond that, it's symptomatic treatment for other issues.
And the vaccine point again.
Yes, avoid those modified live virus vaccines, especially if you suspect a T lymphocyte problem.
Got it. And follow up.
Regular checkups are essential. Monitoring for new infections, seeing how well antibiotics are working. It's ongoing vigilance.
So if we can't cure these, prevention really seems like the most powerful approach long term.
Absolutely.
Yeah.
It really comes down to responsible breeding.
Meaning?
Animals known to have a primary immunodeficiency simply shouldn't be bred, period.
Mm-hmm.
Analyzing pedigrees, family histories is incredibly important to understand how these traits are passed down within a breed. That's how you prevent passing on these genetic lines.
Makes sense.
And while the main complications are always those infections, the overall outlook, the prognosis, it really depends on the specific defect and how severe it is. Some pets with milder deficiencies can be managed pretty well.
Okay.
They can live reasonably comfortable lives with careful management.
So just to recap then, we've really dug into primary immunodeficiencies in dogs and cats today. We've learned these are inherited immune system problems, making pets vulnerable to infections, and certain breeds have higher risks for specific types.
Right. Diagnosis needs careful workup, ruling things out, often specialized tests.
And while there's no cure, management is all about controlling infections and good supportive care.
And the key takeaway for you, our listeners, especially if you own pets or you're involved in breeding, is just the importance of being aware.
Yeah.
Understand the genetics, the potential health issues for individual animals, and for breeds as a whole, it's crucial for responsible ownership and breeding.
Which kind of leads us to our final thought for today. Given that these are genetic and we see these clear breed links, it really makes you think about the long-term genetic health of purebred dogs and cats, doesn't it? What's the role of genetic diversity, or maybe lack thereof? And what more can breeders and organizations do to, minimize these inherited immune problems?
That's definitely something to ponder. A really important question.
Indeed. Well, thanks for joining us for this deep dive.